Welcome to Middle Fingers Up, the show where we hold our heads high and our middle fingers higher. I'm your host, Kieran McKay. Today's guest, Dr. Shazma Mithani, is an accomplished emergency room doctor based in Edmonton, Alberta, Canada, who works with both adult and pediatric patients. Beyond her critical work in the emergency room, Dr. Mithani is also a passionate advocate for health literacy. So through her popular social media platform, she aims to empower individuals with the knowledge they need to stay healthy and hopefully avoid any unnecessary emergency room visits. Her weekly 1 to 2 minute videos cover a wide range of health issues and hopefully providing valuable insights and practical advice for those of us that are not in the medical professional field. I'm really looking forward to learning about Dr. Mithani's journey, the challenges that she may face as a physician, and as well as the importance of the health literacy. What are the gaps that led her to create this platform and how it's going so far? So let's welcome Dr. Mithani. Thank you so much for being here. So happy to have you today. How are we doing?
Thanks for having me. I'm doing well.
Good. Is there anything in your intro that you wish I had added or that you want to highlight for our listeners?
No, I actually think you nailed all of them. So thank you for that.
Oh, well, that's always good. Thank you. I'm glad. Well, why don't we just take a couple seconds here before we get into the business side of things and learn a little bit about you. I've been a patient in the emergency room numerous times, anaphylactic allergies, all sorts of things. So I know what it's like to stand, sitting there for 12 hours on the patient side, but always curious about how the staff, the doctors and nurses, do their thing on the other side for 12 to 15, if not more hours. So when you're not busy in the ER or educating the public, what are you doing outside of that? What are your hobbies? What are some favorite downtime things that you like to do should you have that time to do it?
Yeah, one of the small pros of being a shift worker is that there are little bits of time. So for example, today I'm working an evening shift, which means I have the day to do some things. So my hobbies include tennis. I've started to play tennis in the last couple of years. I really enjoy learning a new sport as an adult and continuing to use my brain in that way. I've been playing ultimate frisbee for almost 15 years now. So love that sport. And then otherwise I like to run, go camping with my family in the summer, skiing with my family in the winter. So really just trying to be outside and be active in different ways.
Oh my gosh, lots of things. I wonder, do you see patients coming to the ER with after skiing, snowboarding kind of sports? Or what sport brings the most athletes to the emergency room?
I don't know if there's a specific sport that brings it. Cycling definitely can, if somebody's doing high speed road cycling, but there's no specific sport. There's certainly some activities that come to mind, but no specific sport that comes to mind that has a disproportionate number of injuries.
Oh, that's funny. Okay, so what's one of the most funniest or memorable moments you've had while working in the ER?
I mean, lots of memorable moments. Of course, it's always the challenging ones that stick out in my mind. But there's recently, a few months ago, I saw an unhoused patient that was coming in to be seen, and I was managing him. He was going to be discharged, and he was calling a family member on the phone just to update them. And I learned that it was his birthday. I don't pay attention to people's birthdays when I look at their chart, right? So I learned that it was his birthday. And so I decided to run downstairs to Tim Hortons and grab a donut and bring him up a donut for his birthday. So I try to in the sea of badness that is often the emergency department. Yeah. I try to do little things like that when I can for patients, just to have a little moment of kindness when possible.
Yeah.
So that sticks out.
Oh, I'm sure that was impactful. Who wants to be in the emergency room on their birthday? So that's kind to I'll take a donut any day, let alone on my birthday in the hospital. So that's amazing. Anything unusual or surprising that you've learned about medicine or health while being in the emergency room that maybe you weren't taught when you went to doctor school? Like what is something that like you're like, oh my goodness, this is something I wasn't prepared for, or I've learned through being an ER doctor?
Yeah, I think honestly, like the weight that we carry as healthcare workers, that is not. I think we're starting to talk about it a lot more as learners come through. I'm 10 years into my career, which isn't that long, and it certainly wasn't something we were talking about even like 5 years ago. Just the weight that we carry when we are managing challenging patient situations, challenging kind of social and family dynamics, and the impact that has on us as individuals beyond just the shift that we're working.
Right. Yeah. Okay, so there's a stereotype for emergency room doctors, and maybe you've heard this, and maybe you can debunk it or tell me if this is true, but people always say emergency room doctors are the jack of all trades. You guys work with love of procedures, there's a short attention span, and maybe even like a fondness for crisis situations. So do you think that that's accurate, or would you say none of those make sense?
I would say many of those make sense. Yeah. Just thinking, I'm like grinning here. Yes, Jack or Jill of all trades for sure. Like emergency medicine is a specialty that requires a vast amount of knowledge about many, many things. And the more kind of strapped both primary care and acute care are becoming, the more knowledge an emergency physician requires to start to manage things that are not traditionally what we've managed.
Right.
So yes, definitely like Jack or Jill of all trades. We all love doing procedures. I think a big reason for me that I went into emergency medicine is that it's a really good mix of kind of investigative medicine and procedures. I love that mix of those two things. Contrary to what like TV says, it's not always just like crashing patients coming in the door. Like there's a lot of more, like most people are quite stable, like unstable in small ways, but like generally quite stable. And we have the time to like do a thoughtful workup on them and kind of help to figure out what's going on. But, a smaller percentage of patients are crashing.
Yeah.
And those patients are like certainly get the heart rate up, but are really intriguing to manage just from like even at like an intellectual standpoint, right? To really have to think through things and think about like what can we do differently beyond just algorithmic care that we are trained to do.
Yeah, because you don't have our history. You only know what we're telling you and what you're seeing, I guess. And then, like you said, the rest is the investigator work, the blood work, whatever else you guys may choose to do. And so I always think it's like ER doctors and vets have so much respect from me because you have to know so much about so many different things and you don't know what's going to show up today or tomorrow or whatnot. So there's a lot of respect there from a lot of us. And I think there's, like you said, there's a lot of talk going on about, and it's good to hear that on your side, you and your colleagues and from that side of things are also recognizing the struggles and the gaps that on your end you have to face. And I think that's a parallel process with us patients on this end who are also experiencing that. So we'll talk a little bit about communication and mistrust and all that and how we're working towards bettering that. But I thought maybe at this point we can give a little shout out to Dr. Shafina, who is the person that I have to thank because that is how I found you. And I know we're going to talk about social media, but this is the thing that I actually quite like about social media is that networking part. If it's used in the right way, there's so many people out there that can, be in our resource pool. And she's one of them. And she spoke so highly of you because she had shared some of your work on her page. And I have to give her a shout out because she actually encouraged me. I'm always like, oh, should I reach out? And I don't know. And, you have like a lot of followers, Doc. So I was like, I don't know. And she's like, you should definitely reach out. So I'm so glad that she suggested that. So huge shout out. She was on episode 66. We just need somebody to write out a midlife care plan, which I really appreciated her talking about that. So
Shafina is awesome. So and so happy to hear that she connected us.
Yeah.
All the positive things to say about her as well. She's doing great things in women's health and women's care.
Yeah. And I just like for both of you, it melts my heart, just on South Asian to South Asian. It's really nice to see women in our community and roles like both of you. And also focusing on the things that many of the generations before us just have not been able to, don't understand. And so this is why I'm really excited to learn about your story because I imagine there's a lot of those gaps growing up as well that we all see when our parents take us to the doctors, or when we have to take them to the doctors to translate or whatnot. So thank you for doing what you're doing. And I'm sorry when we're all cranky with you guys because we're not getting what we need. But I think at the end of the day, like it's very much appreciative. And every time I leave Canada, I'm even more grateful of the health services that we do get, even though, we got work to do. But let's pause for a second and do our middle fingers up, and then we'll jump into it. And then we'll start learning about you and your platform. So what do you want to put your middle fingers up to today?
To health and wellness, quote unquote, influencers who have no credentials behind what they say and perpetuate the spread of dangerous health misinformation on social media.
So let's get into that. Let's go right there. So can you like break that down for us? What about that are we putting our middle fingers up to? Like, what about that particular statement?
It's this group of people who have gained momentum over the last several years who are preying on the vulnerabilities when it comes to health concerns and to health questions. Being concerned about your health is a very vulnerable thing and a very scary thing. And where there are vulnerabilities, whether it be in health or other things, there is this opening for other people to benefit from that from a financial standpoint. And the thing that I find most upsetting and frustrating about these health and wellness influencers is that they are preying on those vulnerabilities to their own advantage. So they're selling garbage supplements that do nothing, right? They're putting out quote unquote holistic or natural remedies that you can do at home that have no evidence behind them and can actually cause harm. So things that come to mind are things like coffee enemas. People have gone to the emergency department from complications of this and it does not work, right? Selling supplements to like detox supplements. Your liver and your kidney are excellent at detoxifying, and those are things that you don't have to pay for. They're just in your body and that's what their role is. And so the monetizing of health and wellness spheres is extremely frustrating, being someone who's in that space trying to, for free, put out credible and valuable health information to actually educate people. Having to fight against that massive industry it's a challenge for the group of us that are trying to do the right thing.
Well, and where do you think the challenge lies the most? Is it like, you have a Kim Kardashian who everyone knows and is selling the product, and you're a doctor and don't have 1,000, a billion, 100,000, however many followers. Like, I can't even count that high, to be honest, that someone like her might have. So not to say that she's selling them, whatever, but she's the one that stands out to me and her whole family, because they're always selling vitamins and all these kinds of things. And people then have started to follow the door that the Kardashians essentially opened for many people, right? It's a job that you can create for yourself, and people have been very successful with it. So where in all of that is the problem that we could break apart or look at? Is it the selling part? Is it the social media platforms that we're, worried about? Like, what do we have to pay attention to? If I was, my mom listening, or someone that is vulnerable, doesn't know much about some of the healthcare issues, and I'm reading about it or going on TikTok every day and learning about it, or what, where do you see the issue coming for the folks that are like, oh yeah, I will buy this, or maybe I should go rub that oil on my leg and it'll make it better, or whatever it is that people are saying?
I think honestly, it all comes down to what people who are consuming information put value in. And we can bring it all the way back to like even before social media, like think about celebrity endorsements for products, right? So there is this level of trust and credibility that is given to people with fame. So you can list many, many celebrities in that space, right? And then that has been translated into the social media space from celebrities to start, but then now it has bled into kind of social media content creators and influencers where credibility by the people consuming this information is put on the number of followers someone has. And so, just because someone has 1 million followers and is telling you health information doesn't mean that they know what they're talking about. If they're a physician who is trained in that area, or like, some other regulated health professional who is trained in that area and is giving you specific information to what they're trained in, sure. And they happen to have 1 million followers, great. Like that, then, that's the exception, I would say. But in general, there's a lot of credibility that's put into the visibility and number of followers someone has in terms of listening to the information that they have to put out there. And I think that is what it all comes down to, is what goes into the decision process of who you're going to trust with information that they're giving to you.
Mm-hmm. And so for you, like, what would you recommend in just what you just said about that trust piece? Like, what should we be looking at? Because I'm not on TikTok, so forgive me if I'm not getting it right. But like, from my understanding, what I've seen, everyone has access to that. Everyone, every age group, everyone all over the world. And it's a lot of information. And on one hand, you know, I know people that are accessing mental health information because, you know, I know some South Asians that are, for the first time, they have family members that are experiencing some really hard mental health issues, being hospitalized. And the medical system isn't really helping the family with language barrier and cultural beliefs and all that. There's a clash. And so then the family sort of feels rejected, and then they go to TikTok or wherever else on social media. And just like you said, oh, this person's got a lot of followers. They must be really good at talking about the thing. It must be real, whatever reason we believe it. And, you know, on one hand, there is some information that some would say, okay, this is helpful. Like being in the mental health field, sometimes I also worry because you go to one person's platform and they can talk about ADHD, and then you go to someone else's and they're going to say the exact opposite. And so it would be the same in your medical field, I would imagine too. So for those people that are being rejected or have long wait lists or feel like the medical system maybe isn't, you know, is quick access, because that's what you're working against, quick access with being on your phone with TikTok. Like what advice would you give to those of us that are listening today about what we can do to prevent some of those emergency room visits that are unnecessary, as well as how do I do better research when I'm going to go online and get information about whatever it is I'm struggling with?
Yeah, I mean, I'll start by saying that I completely understand why people are turning to social media and the internet to get that health information, right? Because there is an access problem right now in terms of being able to get the care that people need. So I'll start by saying I 100% understand why that's happening. Yeah. And I would say that in response, and that is exactly why there has been this space created for non-credentialed influencers to be in that space and capitalize and profit from it. Yeah. So it makes sense that that space has been filled by this. And I will say that now, like, there are credentialed individuals who are recognizing that that space has been filled by misinformation and really trying hard to make a concerted effort to push against that and also get into the social media space. And so to answer your question, I think it's really important to think about if something sounds too good to be true, it probably is. If someone's trying to say, like, you know, do this quick hack or take this pill and it's going to solve all your problems or this specific problem, more likely that, and they're selling it to you, red flags everywhere, right? So like, it's important to take a step back. And I get the vulnerability piece of it and the desire to have a quick fix and how scary health is. Take a step back and think about, well, are they trying to sell me something? Does this sound too good to be true? If those two things or even one of those two things are the case, then run. The second thing is ask yourself, like, what is the training of this individual? Do they actually have the letters after their name, so to speak, or the training and credentials and the education that's required to have any sort of merit or value behind what they're telling you, right? Are they someone who is, in a regulated health professional? So are they a dietitian, which is a regulated health professional, versus like a nutritionist where anyone can call themselves a nutritionist, right? And that nuance is not often known to the public. And so digging into, like, looking at their bio, clicking on the links that they have in their bio. And that's often what I do when I'm following people too, right? If someone follows me and I look at their page or look at their bio, I go and click through things to understand what their actual training is before I decide if I'm going to follow them back or not, or what value I'm going to place on the information that they're giving me. Right. So taking it's a couple minutes, right? It's a couple minutes to go and do a little bit of digging to understand what the background is of that person, whether they have any secondary gain in the interaction that they have with you. And those couple minutes can be quite valuable in helping you decide what information to listen to and what information to just dismiss and throw away.
Let's move into your platform. So you post these weekly, just short videos, because all of our attention span, even 1 to 2 minutes now is too much. So we watch these videos, and what can we gain from following you, from learning with information that you're posting for us?
So there's two kind of avenues that I really try to put out there on my social media platforms. So I'm mostly on Instagram. I'm on TikTok as well. It all kind of stemmed from like from the pandemic, to be honest. So like at that time, it was a scary time for frontline healthcare workers. In the emergency department, I was seeing what was happening to my colleagues in Italy and New York, and quite terrified for myself and for my family. And so I initially went to social media to learn about like real-time things that were coming through from my colleagues in those spaces. And then thereafter became being a part of that conversation to help get credible information out there about the pandemic at a time where misinformation was really starting to grow. And then from there, so I grew a following on Twitter, now X. And from there, like as people did not want to hear about the pandemic as much anymore, what we realized in the acute care space and in the emergency department in particular was that we were getting slammed with people who didn't have access to care. And we were really seeing a lot of higher kind of sicker patients, higher acuity patients that were kind of needing care. And so I decided to kind of pivot onto a more visual platform. So I went onto Instagram and TikTok and kind of organically grew my following over the last kind of 2.5 years there, where I was wanting to get credible kind of short snippets of health information out there to help inform people and to ideally try to keep them out of the emergency department. So, I remember my very first video was on like how to stop a nosebleed at home, because the number of times that I see people come in of all ages who come in with nosebleeds that are like 99% of the time harmless, who don't know how to stop a nosebleed possible. Like those are emerge visits that don't need to happen. And that's important from a system standpoint, but also important from like the individual standpoint. I don't want people to have to come in and wait hours in the emergency department and have like a 2-minute interaction with me to teach them how to stop their nosebleed and then be sent out the door, right? That's a waste of their time. So a lot of that has to do with kind of getting that information out there and empowering people and improving their health literacy to give them the tools that they need at home so that they can manage things at home, and even just like learn a thing or two, right? Maybe they don't need this information, but maybe they're talking to their friend tomorrow that happens to need this information and can send them this way. So that's one piece of it. And the other piece of it is just ongoing advocacy for our health system. So for me as an emergency physician, I get to see firsthand what happens when we have a failing health system, and also what the potential consequences are if we no longer have a public and accessible healthcare system. And so like for me, that is my hill to die on. I don't want any person to ever have to pay for healthcare. It is a fundamental human right. And so I also use my platform to help people understand the potential negative consequences of losing this precious and valuable resource that we have in Canada.
Mm-hmm. First of all, I want to thank you for what you're doing. I'm so grateful for people like you that are so observant, notice the gaps, and also you have colleagues around the world doing something similar. So also networking and understanding like what this is a world problem. We always compare health country to country, and still grateful on many levels. But also I thought, that's kind of neat that you also get to talk to your Italian doctor friends and doctor friends in Asia and other parts of the world, where you guys can look at what are the global issues and what is something that we can all come together and conquer. And on one hand, COVID did do that. That was a world global issue. We saw everyone, professionals coming together and really trying to put the resources down for everyone. And I thought, oh my gosh, it's too bad we had to have that happen for that. And can we keep doing stuff like that? And so, when you talk about something like the nosebleed, I just want to go back for a second. Can you, maybe there's top 3 or 5, I don't know. Like what are the top reasons that people like a nosebleed would show up in the emergency room? Because I'm sorry, I'm a little surprised that some of us are going in there for that. So maybe you can speak a little bit more about where you think that's coming from, why we're coming in for that, and what are some of the other things that we could practice at home that you see quite often. I know we can go to your page, which will get your information and check out your other videos. The Q-tip one, like I said, was my favorite because I need to play that video every day. So what are the few things that you're finding people repeatedly coming in, like the nosebleeds, that we could, be educated and work on from home?
Yeah, I think a big, to kind of answer the first part of your question, a big reason that people come into the emergency department is twofold. One, they don't have access to something in the community, right? We have now like a record number of patients in Canada who don't have access to primary care or family doctors. So that's the biggest reason, right? And when you're worried and don't know what to do, you go to the emerge, whether it's, and I never judge people on whether they should be there or not, because I 100% understand all of the events that would have led to them coming there. So that's the first thing. And I think the second thing is that just there is this growing lack of health literacy in the general population, right? And this is kind of what me and my colleagues are trying to get out there, is to increase that health literacy of the population. So because knowledge is power, and to really just like get that basic level of understanding of the health and the health system out more widespread. And then to answer the second part of your question in terms of like what I see a lot of. So in the pediatric population, it's all kind of related to infectious things. So my kid has a fever. I'm worried that the fever is too high. That's kind of the biggest thing. And then my kid's been coughing for weeks. So those are the kind of the two most common things that I see in the ER. Those, and if you go to my page, those are the two of the pinned videos that I have on my Instagram page for that exact reason, because it is something that I see so often. A lot of other, so nosebleeds are another common one as well in kind of in all ages. So those are kind of the big things that come to mind in terms of what I'm seeing a lot of. And all of my content is kind of inspired by what I'm seeing at work, right? If I'm seeing a stretch of things that are coming in where people are concerned about a specific issue, like that is informing what I'm putting out on my social media channels.
And so what kind of questions do you get on your social media channels? You always have an open-ended sort of process. You invite people to provide feedback and ask you questions. So what are people asking you on the platform? Like, what are you learning about?
Yeah, so lots of questions about whether different home remedies or supplements work. And I love getting questions like that, because it's something that I feel quite passionate about. And so it's great that I'm getting those kinds of questions in my DM. So lots of questions about like, does this work? Or someone will send me like a video or a reel or a post about something like, hey, this content creator said this, is it legit or not? And so it's great that people are coming to me as a resource to kind of debunk that misinformation. So that's a big one. And then a lot of times, people asking about, I know you had a video on this. Can you kind of just flag it for me, sort of thing. So yeah, things like that.
What do you wish people would ask? What's the question that you're hoping to be asked, or that you hope to see more of when people reach out to you?
I definitely am, one of them is the misinformation debunking. So I always am happy when people are checking in with me first about something to, again, they've identified that maybe it's too good to be true.
Yeah.
And we'll check in about that. So I'm glad when people ask me about that. And then I would say, I think I wish people not necessarily ask me about, but like would continue to engage on the advocacy content that I'm putting out there in terms of kind of preserving our public healthcare system. And those posts often get a lot of engagement. And so I'd say just ongoing engagement in that space, because it is, I do believe it's something that is very much at risk here in Canada. And the more people are worried about it, the more it can help kind of galvanize and mobilize the population to help fight for it.
Yeah. Are there things that all of us can be doing, to join that fight and work together to fill that gap in the best way possible for all of our health and the system? And like, do you have ideas or things that you've seen that are working and you're like, do more of this or less of that other thing?
I think a lot of it happens in the conversations that we're having with people. And so just being informed on the nuances of, public versus private healthcare, for example. So there's a great organization called Canadian Doctors for Medicare. So you can find them on Instagram, and they do have a website, and they have a lot of excellent kind of evidence reviews on the value of public care and the drawbacks of kind of user pay care. And so just being informed in those nuances will help to allow you to have those conversations with people. And I think conversations with your friends and family about these things are really what go the longest way, because it's those exact things that also spread misinformation, right? And so being armed with the evidence-based information and understanding the issue well, so that you can continue to have those conversations out in the public.
Yeah. And just to learn a little bit about you for a second here. I'm just thinking, listening to you and just imagining little Dr. Mithani back in the day is when you look back and your decision to go to doctor school and become a physician, when you look back now and look at the way that you're incorporating social media into your work and all, are you surprised by the platform and your work coming together, or is this what you envision? Is this what I went to school for? What's happening? He's just 20 years ago, 10 years ago, I would never imagine my doctor being on social media in that way. And I don't even know if my doctor is right now, to be honest. And so I love it because I think it's also relatable, right? To see physicians on there. It's less scary, all the things, all the reasons that you talked about why you're doing what you're doing. But when you think of little you about to go to school and make this decision, what comes to mind?
I would not have imagined this in a million years. Like, no way. It's so interesting how it's a good reminder that I think to anybody who's in a specific career that it's so unpredictable, and it's really important to kind of also just go with the flow sometimes and kind of see how things are going to evolve. I mean, literally, if you'd asked me even 5 years ago, right? 5 years ago was like kind of just when I was starting to think about getting into social media. It is, I wouldn't have guessed that me trying to get in the space of learning about COVID would have turned into having now this platform where I get to educate people every day.
Right. What is your favorite thing to educate people about?
I think whatever I'm seeing in the emergency department. So for example, like I worked a string of shifts this past weekend, and I saw a ton of hand, foot, and mouth disease, like just a cluster of cases. And so for me, immediately I'm like, hey, I got to get that information out there because I want parents to understand like what to expect and what to look out for. And so for me, it's kind of tying work and social media together to being able to kind of like intertwine those two things together is really fun and interesting for me because it's like this real-time response that I get to have.
Yeah. And I think I talk to artists as well. And a lot of what I'm hearing you say, it's so interesting to compare physician and artist, but it's that observant kind of mentality of you're literally every day in a social experiment. Every interaction you're learning. And so I would imagine when you're in that emergency room, there's probably so many gaps coming at you where you can write your list of, you have content for days and weeks and months, I would imagine, based on what you're seeing. And then also like the flux of things coming in together, these flus, or if it's the e-scooter stuff, which I am so surprised has not come up by you yet, because I even said to my husband this morning, I'm like, I bet you Dr. Mithani's MFU is going to be about the injuries on the scooters because we all laugh at it, but this is legit what's been happening for how long? And it just seems to be getting worse and worse and worse. And so I'm like really curious about that whole world too, because there's all these new things we can be doing for recreation, transport, diet, all these kinds of things. And so many of them are working against us. So when I see pictures of your like injured people from being on a scooter, personally, I'm too scared. I've never gotten on and never will because I'm like, there's no way I'm going to go from point A to point B alive. Like, I just don't feel like that personally. So can you talk a little bit about the scooter experience and like what, if everyone was listening, what was the one thing you'd want them to know today? Should they, before they get on that?
Well, I would want them to just not get on it to begin with.
It's just like get rid of them. If you were running for mayor, that would be the first thing you'd get rid of.
Yeah, I'm sure it would be a very unpopular opinion because people love these scooters. But I mean, I can tell, and I've been, full disclosure, I've been on one once. This was before they came to Canada. I was in Nashville. This was like 7 years ago, and they had just been kind of introduced in the States. I was fully sober. I was on a side street, a quiet side street in Nashville, and I went like 20 meters with one. And I was like, oh, okay, this is kind of cool. Fine. But and like, admittedly, I was like talking to my husband, we were together. I'm like, I don't have a helmet. Should I get on one of these? Like I went through the whole emergency doctor process of like, should I get on this scooter? And went at like low speed for like kind of 20 meters. But then, now seeing on the other side of it, how popular these have become and how many injuries we see in the emergency department from these e-scooters. Like, most people are not wearing helmets. So we have seen devastating head injuries. Like people have died from their head injuries that they sustained. They're going at high speeds. Most people are often like not like under the influence of some sort of substance. So judgment is impaired, stability is impaired. And then even if you happen to be wearing a helmet, the rest of your body is still completely exposed. I've seen like severe broken bones, rib fractures, like spleen ruptures, like all of these very significant injuries because of these e-scooters. And so like for me, these are entirely preventable injuries. And, there are lots of other ways of active transportation that are much safer, like bicycles, for example,
Mm-hmm.
or, not non-motorized scooters as well, where I think that like there are other ways to do this where it's less dangerous, right?
Yeah, for sure. So I want to get into a little bit about you and your journey to becoming a doctor. Before I do that, I just want to wrap up, like, anything with the health literacy and preventative care that you want to put out and say to our listeners, that maybe something like about that I didn't even ask you about.
No, I would just reiterate that, like, just be really, really careful about where you're getting information from and just being really critical about the information that you're consuming. That's the biggest take home for me.
Right. I agree with that. And I bet it's like repetitive. You have to say that so many times because there's just so many things coming at all of us, including our kids. And you're a parent, I'm a parent. And every time you're in this generation of like parenting, the new generation, there's so many new things that are coming out that, we didn't learn or know about when we were growing up, and our own parents. And I wonder if that's part of the struggle as well. Is we have a lot of young people that have so much quote unquote education at their hands with social media, all the platforms we talked about today. And so I don't know, maybe this is just all young people and I was different, but I even see with my 13-year-old and my 10-year-old how much knowledge they have about things that maybe they shouldn't have knowledge about. And so I'm wondering if you have examples or anything that comes to mind about when we put that much information. We said knowledge is power, but also with great power comes responsibility. And so when we put that much information out to our kids, do you have any feedback for parents or caregivers that can help maintain and manage some of that with our children? Because they're seeing a lot, and not all of us are recognizing that they're learning and seeing all these things.
I think, so my kids are 5 and 8. They're like, in my opinion, too young for smartphones or devices. They have like, tablets that they have very limited and controlled time on. That's always supervised by my husband or I. But I would say, talk to your parent friends as well. Like, kind of make sure that you're all on the same page in terms of what your kids and their friends are able to access. For me, eventually my kids are going to need access to phones. Yeah. I am going to be quite deliberate about like not giving them a smartphone for as long as possible. So like a flip phone is just as effective at communicating with someone, right? Like, It doesn't have to be a smartphone. And so really pushing that as late as possible. And there's a lot of evidence to support that, right? So pushing that as late as possible. And when they do end up having smartphones, having parental controls on it, and then also like spot checks, right? So like uncontested, if I want to take your phone and look at your phone, I get to have it at any point in time to look at it, to look at the browsing history, to look at what you've been doing. And so just because and as much as that, I think may feel like an invasion of privacy, it's also like I'm giving my kids the privilege of having this device. I'm paying for this device, and there have to be boundaries and rules around it. And so for me, that's kind of, because it's certainly something that I think as parents, we think about already. Like, my kids are young, but it's only a matter of time before they're going to have access to this social media space. And we know that there are positives to this space, knowledge is power, like you said. We also know that there are a lot of negatives in this space in terms of mental health concerns when it comes to social media, misinformation spreading. We've all seen examples in the news of this, right? And so it's definitely a scary space that I'm going to tread very lightly with when it comes time for my kids.
Yeah. Just before we move forward there, you mentioned with the mental health and the social media, like in the emergency room, would you say it's increasing the amount of young people or adults that are coming for mental health treatment? Or are you saying that there's a balance between, I had a physical injury and the mental health injury? Or are you seeing one or the other more?
There's definitely been an increase in the need for mental health care. For sure.
Yeah. Is there anything in particular or a theme or what? Like, if you were going to go make a video tomorrow based on patients coming in the last week with mental health issues or in the last while, is there a particular theme or something that stands out that you've noticed?
I would say, and I think that there's like data to support this as well, just that there has been an increase in like anxiety in teens and younger kids in the context of like this post-pandemic world. There's a lot of people kind of talking about this as well. And I've certainly seen it. in my experience at work.
Mm-hmm. Yeah, and I would agree too. In my household, I see it. I also feel like for us adults too, it is a different world. We were all waiting for what the new, post-COVID world would be, and a few years in, we have a sense of what it is. Interestingly, like I don't think as quick as we were expecting to, notice what struggles would come out of that without the economy and the financial burdens. Mental health related, I feel like people are just now starting to even talk about, oh yeah, this is because of what happened a few years ago. And I've just been coasting or trying to just get through. And now I'm realizing a few years later, like I can't just live like this. And in that time, people are talking a lot about their anxiety, their depression, all these kinds of things playing a part with that. So I was curious about what it's like in the ER right now with mental health services, and or would you say a lot of patients are taking up those beds as opposed to coming in for injury or need a procedure?
I would say that there's been an increase for sure. And then, the other thing that kind of is at the back of my mind that I don't know that we've seen the full effect of yet is like just the increase of substances during the pandemic, right? We know that the amount of kind of alcohol use during the pandemic increased significantly. And so it's going to be, I guess time will tell what sort of longer term effects that's going to have on the health of individuals and what we're going to see in the coming years from that too.
Mm-hmm. Yeah, we were having an interesting conversation at dinner. We had my son's friend's parents over the other day, and that was part of a conversation just about realizing after COVID and a while after of like, oh, some of these routines that we, just kind of inherited, these are not things that we should be, these are, in the moment survival maybe, but this is not for, the long haul. And how do you undo that? Because those bad habits can form quick. And if our anxiety is increasing, a lot of us are likely increasing some of those not so healthy coping strategies too. And so, okay, well, let's pause for a second. Let's learn a little bit about, so how did you decide that this was a career for you? Like what's the story that led you to want to become a doctor and be so passionate and help people in this way?
A bit of both, I would say. My parents are first generation Canadians, right? And so they, I'm sure similar to your parents, put a lot of value on education to give us a better life, so to speak, right? That's always kind of what they said. We want to give you a better life to my sister and I. And so they really placed a lot of value and importance on education, which I'm very glad that they did. And then because of that, they're always like, like the professional careers that they would throw around in terms of like, well, you should be a lawyer or a doctor or a dentist or an accountant, like all of these kind of more own a business, these professional type careers where there would be stability in that, I think was the biggest thing where it was coming from. And so for me, kind of like as I was going through school, I definitely enjoyed biological sciences from the get-go. Like as soon as I went into junior high school and was able to kind of do more of that, it was something that I understood really well, that I had fun learning about, which felt important to me. And so initially I thought I actually, like going into university, I thought I wanted to be a researcher, like a medical researcher or a scientific researcher, and then did a couple of summers of research in my undergrad that I did in pharmacology and realized that like research just wasn't really my jam. So thought a little bit about that, did some shadowing, those sorts of things. And it just felt like medicine was a really good combination of like the people skills that I really wanted to maintain and biological sciences. So it felt like a good mix of those two things as a career. And so that's kind of how that evolved.
Nice. And so when you were going to school, did they talk about like what to expect as the biggest challenge for a physician? And are you experiencing that same challenge, or have the challenges changed over time?
We did not have conversations about challenges as physicians in any sort of a meaningful way, I would say. As I kind of mentioned earlier in the podcast, like this is something that I think we're really being the people that are now attendings that are still in the early part of their career who are understanding and recognizing the impact and challenges of medicine as a career are really trying to do our part to help the new generation of physicians and medical students understand that it is something that's part of this profession, but also like what are things that can be done to help mitigate it early.
Are there differences between the generations, do you think? Like when the new the new freshies come out, and you probably remember how you were 10 years ago. Like, are they dealing with similar stress or similar things that you were, and are they handling it in the same kind of way? Each generation change is so interesting. And so I'm just curious if like issues and changes and transition have evolved over the time, or it's about the same kind of stuff that you see with your first year or the new docs, like, and now you're 10 years in.
Yeah, I would say yes and no. So in one way, it's the new attendings just started, right? So residency kind of goes from July to June. And so the graduating residents have just started. And in seeing the people that have started in the department that I work in, it takes me back to like when I first started, right? Like all those same anxieties and stresses about being out there on your own for the first time without any sort of like attending looking over you and checking your work is you can see that anxiety is there. And thankfully, like we as a group are extremely supportive of each other. And so hopefully that's eased things a little bit for the newer people. But I will say that like kind of in, med school and residency, like before you kind of finish and become an attending, it's really great to see how people are putting a lot more value on what they need for self-care and to reset. And so to like, not always say yes to everything, to have kind of some boundaries in place to ensure career longevity and also to mitigate burnout. So it is really nice to see that is something that is now being implemented.
Yeah, I was thinking,
and I would say that there is a generational difference with that for sure.
For sure, right? I was talking to colleagues that are in the mental health world that are creating training plans with the new generations coming in to work in mental health. And I was asking, I'm like, okay, what are the top 3 things that you're looking at? And she said one of the big thing is not the training for the new generation coming in, but it's a training for the older leadership from the other generations that really have to understand how things have changed. Like my generation was very similar when I went into the workforce that, when I had the elders that were supervising me, there wasn't a whole, I was like loyalty, stay in the same job and sacrifice and all that stuff. And that stuff's coming out a bit different, and not to say one's better than the other, but I think that the reason why I asked that is my follow-up is like, is there a gap in getting medical students to go and get through the programming? Like I've also read stuff and heard that after COVID, it was hard to get around the world nursing and medical professionals to enter the field. And so I'm just curious if you guys are feeling that over there, because you also mentioned burnout, and sometimes there's a turnover correlation with that. So just curious if we need more people to be entering that field or what, or how are we doing with that?
I think it's we're feeling it on both sides. So there are a lot of people who are already in medicine who are leaving earlier than they were thinking to, or cutting down in a significant way. So I certainly see that in the departments that I work in, where people aren't necessarily leaving altogether, but they are aggressively cutting down the amount that they're working. Yeah. And so that essentially leads, like that is an effective staffing shortage, right? So the number of people are the same, but the number of shifts that they're working are less. And then I would say that on the entry side, because there's still a finite number of medical school spots, I think that the demand still outweighs the supply. However, when we kind of move from medical school to residency, we're seeing that fewer people are choosing things like family medicine, which is where we really need physicians.
Right. Okay. Do you see, where is a popular specialization? Where are people mostly going to now?
A lot of people continue to kind of go into like medical specialties and surgical specialties with the, I think, assumption that it's lower burnout and easier. Unfortunately, all medical specialties have burnouts, but some have higher rates than others.
So how do you in your profession identify and address the stress and the burnout, and what are the things that you and your colleagues are working on or doing? Or maybe there's other doctors listening or people in the medical profession that could benefit from hearing this, because it's happening and it's going to keep happening. You guys have a very high stress job. So, and shift work can impact mental health and all that is, I don't have to tell you, you know that. So how are you and your colleagues, how would you talk about this or address it? Is it even being talked about and addressed?
I think we're talking about it a lot more, like in the last few years. I have a very good psychologist, and I think that every single person, whether they're in a moment of stress or not, should have a psychologist the same way you have a family doctor or a dentist, right? It is like there is ongoing preventative value to that. And so I would say like having a professional who can help you is really important, and like normalizing that I think is really important. And then, for us, we have each other. Like I have a core group of colleagues that I can always bounce things off of, or if I've had a bad shift, like my husband's not in medicine, so I can't just like, he will never understand things in the way of me just like talking to my colleagues who will get it when I've had, an outcome that I wasn't expecting, or just a particularly hard day. And then I think we're also trying to do our best as physicians to make some system change to make it easier for us to be in this space and to help prevent burnout. But we are still like, healthcare workers are still finite resources in the system. And unfortunately, a lot of times the solution from administrators is to ask us to do more, which we can't just keep doing. So it's a bit of a point of tension.
Yeah. Well, it's also good to hear that there is talk about it, because sometimes when you're being asked to do more and resources are low, you do it because you're doing it, the good and right thing. You're thinking of your colleagues, you're thinking about the system, you're thinking about your patients, but not much is said. So the expectation is you can take it. And so I always think it's a good sign when whatever profession we're in, we're speaking up about it, because we can't really fix a problem if we keep doing the same thing over and over, even though our heart, right? Like it's tugging at your heartstrings because you want to be a team player, I would imagine, and help all of us that are showing up. And it's probably a tricky place to be in, because we kind of need you there, and we can't be treated if you're not well, but then if you're not there, you can't treat us. So it's like, it's a tough, I think, I would imagine, cycle to be in at times as a physician, because a lot is dependent on you. And it's, so, and you're self-employed as well. So it's a whole, I'm telling you all the things that you know, but I'm just, imagining.
It makes it complex, right?
Yeah,
because I mean, like the self-employed piece, I think, is an important piece to point out, because like as we cut back, that has a direct impact on how we can provide for our family, right?
Yeah.
So
For sure. If there were going to be, from a systemic place, a change, what would that change, what would your hope be? What are you guys talking about in between your shifts? Like, what should that change look like? What is the thing that we can attempt to work on? And can we all work on that together? Or is that something that comes from, your side of things?
I think that it would be really great to see some bravery and coordination and collaboration at a provincial and a federal level, because at the end of the day, it's still provincial and federal governments that are directly impacting a lot of the higher level things that filter down to us as healthcare workers. And so there clearly needs to be change in the system. Unfortunately, many things like in the political world run on 4-year cycles. So it's been challenged. Like that's an immediate barrier to having any sort of innovative or brave ideas that may or may not work. And like that needs to just be okay and normalized.
Yeah.
But we can't continue to go in the same direction that we are. And if we want to maintain like this precious resource, like I called it before, of our public healthcare system, there needs to be some change that happens at a coordinated level, and a level of investment and risk that is there to try to make it better. And so I'd love to see that level of bravery at a provincial and federal level to move that in the right direction.
Yeah, I would agree. And some of what I think I'm hearing too is like, a big issue, a big cost, however we want to look at it, is the lack of education a lot of marginalized communities have when accessing healthcare services, or even knowing that they could go on social media and look you up and learn some things. We have immigrants, we have lack of, language, all these kinds of things contribute. And the more we talk about privatizing healthcare, which can benefit, I think, a lot of people in this community, that's one way of looking at it. But at the end of the day, there's way more of us that will not get the treatment that we need. And I think the struggle is real for those that are at the bottom. If, your socioeconomic status is below, I don't even know what, like a poverty, everyone feels like they're at poverty level. But if you're of color, that is huge. If you are an immigrant, if you have lack of access and resources, and the hospital system becomes your revolving door, you start to build relationships with staff there. And there's all these sorts of things that accumulate. And, it's like we wait 4 years, But then I think sometimes, our shift with the government is now we're going to go to the other side, and it's an extreme like pendulum swinging one or the other. And so even though we may not like the way the political climate is, whether it's today or in a few years, the fact that you have to sit there and wait and not know what to do. And then 4 years later, it's like, now we have to relearn a whole thing. And so that's all we're doing is relearn. By the time we kind of get it, we're shifting gears. And I think that really disrupts a lot of potential support, even cost-effective support. So I don't know if there's anything you want to add to that or anything that sticks out to you with that being said.
Yeah, I mean, I think that this is a conversation that comes up all the time. Whenever there's some sort of strain in the healthcare system, there is a big rush of people to say, well, okay, well, then people who can pay for it should pay for it, should be able to pay for it, because then it, quote unquote, takes the strain off the public system. Unfortunately, that is like 100% not the case. The evidence has shown that. We've seen that in other countries where when there is a finite number of healthcare workers and there are two tiers, it pulls from the public system. And the people who stand to be affected the most by that are equity deserving populations, like you mentioned, right? Immigrants, people of color, people who are already in a low SES for whatever reason. And so that is not the solution. And it feels like it, because, it on the surface, it makes sense of like, oh yeah, totally. Like if if people can pay for it, then it like decreases the wait times in the public system. The problem is that it like simply just doesn't work that way. It doesn't. It's happened. It's been done before, and it doesn't work that way. And so I really wish that we could stop having that conversation and again, have that like bravery to like make some different innovative decisions that like may or may not work, but we need to start from somewhere if we want to keep this resource.
Yeah. Well, a lot of it is systemic oppression. And I think you and I and your colleagues and other patients, like we need people at the top to start to make shifts. And I think one way marginalized communities, people of color, people that really need that support, I think the more we talk, and that, like we said at the beginning, is happening more. We are talking more. We have ways to reach each other. I think the more we start to address it, at least that's a start in a way of we can realize, okay, it's not just few people here and there that are chirping about something. We all have this in common, but we need our community, and we need people up at the top. And especially those that could go get that privatized care, those are the people that we really need to step up and help the rest of us so that we can make somewhat of a shift. So, I'm with you on that. And I appreciate, because you guys are caught in the middle of us being mad at you, I'm sure your own colleagues and whatever morale and from the top, so you're kind of squashed in between. And, at the end of the day, I hear you when you talk about the burnout and those kinds of things, because I think that probably impacts the most, the things that are out of your control. You're seeing a way you want to help a patient and your hands are tied, right? And we don't see that when we show up, because we're going to die. We need your help. That's how we showed up. So we're mad at you, but I think the message really is we're fighting the same fight when we're here. We have a different fight up top that we need to get to. So I'm just going to ask you at this point, is there anything you wish I had asked you, or that maybe you want to go back and add to or clarify that we didn't get a chance to, wrap up on?
No, I think we kind of hit the big things. And I would just say, like, to kind of close off the conversation that we were just having, it's important for people to really just always take a step back and recognize the level of privilege that you have in different ways, right? So when you're advocating for something, when you're advocating for yourself for something, think about the inherent privilege that you have as an individual to even be able to advocate for something in particular, right? So like we can talk about whether it's private healthcare or, some sort of position of privilege. Private education is another one, right? Mm-hmm. And think about how it's not necessarily going to impact you, but impact like your neighbors or the people who live, across another, a major street from you that maybe are not as well off and who have systemic barriers against them. So I guess like my closing thought would be that, like, just really always try to keep an open mind, be curious, and think about how things not only are going to affect you and your family, but are going to affect the people around you too.
Yeah. And, when we get to privatizing, so like you said, whether it's school, whether it's health, these systems that were created, we always talk about on this podcast, they all came from settler and colonization times. And when we are now going to go start privatizing things, I think sometimes what it feels like is this method isn't working and we're just going to drop it and we're going to create something cute and pretty and new over here. And when that doesn't work, then what's the new cute and pretty thing, right? And so I think we have to recognize that when we want to make this big change or solution, look behind you. I don't think there's many people that are going to be following that because not very many of us can access that. And so I think the way you talk about privilege for all of us that are living out here in North America in general, I think that's a really good reminder of like, can I share some of this? Can I help fight the fight with others? Even if it doesn't directly impact me, it impacts our society and we're all humans at the end of the day, right? So, well, okay, give us a call to action. So the last thing I'm going to ask you is if there is one thing and only one thing our listeners are going to take from all the resources you shared, all the information you shared today, what would you hope that one thing would be?
Be critical in the information that you're consuming.
I love it. Well said. You're so succinct. I could really learn from you. Well, I want to thank you. I can't believe the hour went by so fast, but I want to thank you for your time. Thank you for giving me this. I know you have a lot on the go. I also want to thank you for what you're doing on social media. We will put all your information up when we post it. Can you just let people know here where they can find you?
You bet. So all of my social media handles are the same. It's at Dr. Shazma Mithani. And so I'm on X, Instagram, TikTok, Facebook. I'm mostly on Instagram. That's where I engage the most. So I would encourage you to follow me there first.
Perfect. Thank you so much for your time. And for everyone listening, these conversations are door openers. If you have any questions or if you want to contribute to this conversation to keep it going, you know where we are. Please reach out. We always appreciate the feedback. Thank you again, Doc, for being here with us.
Thanks so much for having me today.